Welcome to Plasan's 2025 Open Enrollment. In this video, we will cover important changes and updates for your benefits for the upcoming plan year. Plasan is committed to supporting your well-being through comprehensive programming and strategic initiatives, including fostering an environment that makes the healthy choice the easy choice, fostering an inclusive and engaging culture of well-being, and educating and empowering employees to effectively manage and utilize the healthcare system. In this video, we will be covering details for your open enrollment. We will make sure you have all the information you need about important deadlines for open enrollment, including a summary of the 2025 plans and contributions. We will also be providing some education on health savings accounts, diabetes risk, and becoming a better healthcare consumer. Open enrollment will begin on Monday, November 4th, and will close on Monday, November 18th. The last day for changes will be December 4th. This year will be a passive enrollment, which means all of your elections will automatically roll over, with the exception of medical opt-out and flexible spending account elections. Those must be made each year, even if you are not making any changes. To complete your enrollment or submit changes online, visit workforcenow.adp.com through any web browser. Click on the User Login button and enter your user ID and password. Please note, if you have not yet registered for ESS, see Human Resources for instructions. Once you log in, your ESS homepage will appear. Click on the Myself tab up the top toolbar and select Benefits, followed by Enrollments. Step-by-step instructions will walk you through your benefit enrollment. 2024 was a year marked by significant cost increases for both healthcare services and prescription drug costs. As an industry, we are currently experiencing some of the largest healthcare cost increases in the past 20 years, which is expected to continue well into 2025. It is now more important than ever for Plasan employees and families to help keep costs down for everybody by making smart healthcare choices and making sure you are getting the healthcare you need to stay healthy. Plasan is a self-funded health plan. This means that most dollars spent on healthcare are really Plasan's own money paying for those claims. If you or a family member make smart choices on your healthcare, it benefits the health plan dollar for dollar to help control costs. This results in lower premiums and better benefits with fewer changes for employees and their families. Plasan is currently outperforming market trends, and we would like to see that continue. Plasan will be continuing our generous HSA contribution of $600 for singles and $1,200 for doubles and families. Since big changes were made last year to the health plan, we are not making any changes for 2025. We will continue to offer medical through Priority Health West Michigan Partners. As a reminder, Priority Health offers services that are free to you to help members manage prediabetes and diabetes, as well as many other value-added services, some of which we will be covering in this video. You can also learn more about these programs in your benefit guide. Next, we're going to walk you through some tools and strategies to help you become a better healthcare consumer. Health insurance can be complicated, especially when you're dealing with benefit changes. Priority Health is here to help you navigate your health plan. You can reach them at 1-800-942-0954 for help on finding Tier 1 healthcare providers or how to use the great tools and resources provided by Priority Health. Health savings accounts have many benefits. These are individual bank accounts that are portable and can even be used in retirement towards Medicare premiums and long-term care. The accounts even offer investment options to help grow your balance tax-free. This balance rolls over indefinitely. You do not lose unused amounts like you do with an FSA. Priority Health has an amazing app which has all of your medical plan information and tools in one place. This app is available in the Google Play Store for Android devices and the Apple Store for iPhones or iPads. If you already have a My Health account, you can use your existing username and password to log in. Using this app, you can track your spending and see your deductibles and out-of-pocket expenses, find in-network doctors, including Tier 1 and Tier 2, and even schedule an online virtual visit. This app also includes access to Priority Health's Cost Estimator tool. Using the Cost Estimator tool, you can shop for common procedures. Most people are unaware that the exact same procedures can vary greatly in cost even within the same network. MRIs, for example, in the Grand Rapids area can be as low as $600 or as high as $6,000 for the exact same MRI, depending on where you go. When you use the cost estimator tool to shop and receive services at a low-cost, high-quality green provider, you can earn a reward. Priority Health will send you a gift card between $50 and $200 for most services. Keep in mind, these cards can take up to 30 days after you have the service to come in the mail. Make sure you see the reward trophy on your cost estimate to receive your reward. It is important to keep your gift card even if your balance is spent, as future rewards you earn will be sent to the same gift card. Do you know your risk of becoming a diabetic? Are you ready to take action to reduce your weight and improve your health? Plasan offers a diabetes prevention program to eligible employees. The goal of this program is to prevent or delay the onset of type 2 diabetes. You can learn more about your risk by visiting www.priorityhealth.com/prevent-diabetes to learn if this program is right for you. For 2025, Plasan will be continuing a great program to help diabetics manage their condition. As part of the program, eligible members will receive a blood glucose monitor as well as unlimited test strips and lancets at no cost to you. You must be over the age of 18, diagnosed with diabetes, to be eligible for the Livongo program. You can call Priority Health if you think you may qualify at 1-800-446-5674 or to get additional information. Plasan will be continuing our pharmacy savings program through Health Plan Advocate for 2025. If you are currently taking certain brand name and specialty medications that cost over $400 per month, you may be eligible for this program. Eligible employees will automatically be contacted by Health Plan Advocate if you're eligible. It is very important to call HPA back if you are contacted. The call typically takes less than 5 minutes. If you fail to call them back or respond, the cost for your medication will increase substantially to a 50% copay. Once you contact HPA, they will determine if a manufacturer coupon is available for your drug. If a coupon is available, your copay will be reduced or eliminated for that drug. If no coupon is available, you will simply pay your current copay or cost for that medication. Make sure that you're going to the right place for the care that you need. Virtual care is available 24 hours a day, 7 days a week. This is a great option if you need immediate care and do not have a life-threatening situation. If you use a virtual care visit and they have to refer you to the urgent care or the emergency room, there is no charge for the visit. Virtual care is your least expensive option and is free with Plasan health plans. Urgent care visits should be used as an alternative to the emergency room, but typically they're not open 24 hours. The average cost of an urgent care visit is around $180. The emergency room should be your last resort and should only be used for life-threatening medical conditions. The ER is very expensive, with the average cost over $2,500. It is also important to note that if it is truly an emergency situation and you do have to go or an ambulance brings you to a Tier 2 provider, it will be automatically counted towards the Tier 1 out-of-pocket limits. Next, we're going to talk a little bit about your benefits coverages for 2025. Health plan options for 2025 will include both traditional and HSA compatible plan options. Make sure you choose the plan that's right for you. The traditional plan offers a lower deductible but higher employee premiums. It also offers flat dollar copays before deductible for things like office visits and prescriptions. The HSA plan includes a higher deductible, but also the ability to open and contribute tax-free to a health savings account, in addition to Plasan providing $600 for singles and $1,200 for doubles and families. This plan option is great for lower utilizers of the health plan and also is less expensive compared to the traditional plan option. Tier 1 providers include most healthcare providers that members use today, including Corewell Health, previously Spectrum Health, U of M Health West, previously Metro Hospital, as well as Holland Hospital, just to name a few. Most ancillary facilities are also in Tier 1, including most independent surgical centers, like Orthopedic Associates of Michigan, as well as Pine Rest and Mary Freebed. Tier 2 primarily consists of St. Mary's and Mercy Health, owned by the Trinity Health System, as well as non-emergency services at Tier 2 facilities. Plasan will continue to offer the West Michigan Partners Plan Design for 2025. As with last year, you will receive a better benefit and lower deductible if you seek care at a Tier 1 provider. You can still see any in-network Priority Health provider, but seeking care at a Tier 2 provider will have a higher deductible and lower coinsurance level. You will have the same maximum out-of-pocket regardless of which tier healthcare provider you are receiving care from. For example, single coverage maximum out-of-pocket is $6,350 on the traditional plan and $4,500 on the HSA plan. It does not matter whether you use a Tier 1 or Tier 2 provider, it is the same maximum out-of-pocket either way. So if you use a Tier 2 provider, you may hit your maximum out-of-pocket faster, but it will be the same total out-of-pocket amount. West Michigan Partners does not impact pharmacy benefits, and copays are unchanged from 2024. For 2025, Plasan is covering most of the insurance cost increases. Employees will see an overall cost increase of 5% from last year, with the wellness penalty now at a 20% increase, which is higher than the 2024 amount. You will need to complete the wellness plan requirements for 2025 in order to receive the wellness compliant contribution for 2026. You will need to take a wellness visit confirmation form to your next wellness visit and submit your completed form to Human Resources in order to receive the wellness compliant contribution. Next, we're going to be talking a little bit about how HSAs work and if they might be right for you as an employee of Plasan. If you currently participate in the HSA, we do have some important updates, so we encourage you to watch through this section as well. Health savings accounts have many benefits. These are individual bank accounts that are portable and can even be used in retirement towards Medicare premiums and long-term care. The accounts even offer investment options to help grow your balance tax-free. This balance rolls over indefinitely. You do not lose unused amounts like you do with an FSA. HSA contribution amounts have been updated for 2025. For 2025, you can, on a tax-free basis, contribute up to $4,300 for individuals and $8,550 for double or family, less the amount Plasan contributes. If you're over age 55, you can contribute an additional $1,000 annually. The money you spend from your HSA is also tax-free as long as you spend it on eligible medical, dental, vision, or prescription drug services or supplies. If you use your HSA dollars for non-qualified expenses and if you are audited by the IRS, you will have to pay taxes on the money plus a 20% tax penalty. It is good to know that since Plasan does provide a contribution to your HSA, this amount does count towards your annual maximum allowed by the IRS. Make sure that whether you are at the doctor's or pharmacy, you are getting your Priority Health discount. Make sure to show your ID card so that you receive the discount and so that any amounts you pay are properly credited to your deductible. For medical claims, we recommend waiting for an explanation of benefits, or EOB, from Priority Health, which will include the amount you owe after the discount before paying the healthcare provider. Increasing your HSA contribution can make a big difference over 20 years in the amount of money you will have in your account. If you are enrolling in the HSA for the first time, you will be receiving an HSA debit card in the mail. You can also pay claims and manage your account using Health Equity's great mobile app or web portal. Next, we're going to talk about your ancillary benefits available through Plasan. There will be no dental and vision changes for 2025. We will continue to offer dental through Delta Dental and vision through VSP with no benefit changes. Plasan will continue to offer medical and dependent care flexible spending accounts for 2025. Only employees who participate in traditional medical plan are eligible for the medical FSA. With medical FSAs, you want to be sure to only elect what you think you may use, since if you don't use the money allocated in your account, you will lose it. FSAs are a great way to use pre-tax dollars for medical, dental, vision, and child care expenses. You may contribute up to $2,000 for the medical FSA and $5,000 for the dependent care FSA. As a reminder, you must make new elections for the 2025 plan year, even if you are an existing FSA participant. Life and voluntary life insurance will now be offered through Equitable. Plasan includes a paid $50,000 life and AD&D policy for all employees. You have the option to purchase additional life insurance up to $150,000 for employees, $50,000 for spouse, and $10,000 for children with no medical questions asked as a newly eligible employee. If you are not a newly eligible employee and would like to add voluntary life insurance, you will need to provide medical information and complete an evidence of insurability form. Short and long-term disability coverage will remain with Equitable for 2025. Short-term disability provides a benefit replacing 60% of your weekly earnings up to $1,500, which pays up to 13 weeks at no cost to you. Long-term disability provides a benefit replacing 60% of your monthly earnings up to $11,000 per month and pays until age 65 or normal retirement age, which Plasan covers 50% of the premium. The remainder is paid by you. Don't forget, if you have any questions, please be sure to contact Human Resources. All elections should be made online by November 18th. This is a passive enrollment unless you're enrolled in the medical opt-out, the medical flexible spending account, or the dependent daycare FSA. If you're not enrolled or making any changes in those benefits, you do not need to do anything. But we encourage you to still log in and review all of your benefit elections and make sure all of your information is up to date. Thanks for watching. Hope you have a great day.